Mm. Evening, good morning, good evening, good afternoon, everyone from wherever you are. So, welcome to our um, practical home intervention. So, pardon us because we're really having some technical difficulties, but we're on now. So, how are you? Welcome, everyone. Hi, Mommy Sherry Joyce, and from College of Teachers Education, Western Mindanao State University. Hi, welcome. Hi, Teacher Grace. Thank you for tuning in with us. Thank you so much. So, okay, this is our topic for this this day, sensory processing disorder by Dr. Belisa. But before that, let me do our usual routine. So welcome to our practical guide for home intervention. We do this once a week to be able to help our parents in helping their kids at home. So, and we would like to be reminded of our foundational verse from the Bible in Jeremiah 29 verse 11. For I know the plans I have for you, declares the Lord, plans to prosper you and not to harm you, plans to give you hope and a future. This is the very verse and the reason why we look at our kids with hope, not with pity, because we know that God holds their future. And we have so much hope and we have so much faith because He is our help. Also, we believe in Proverbs 22, verse 6. Train up a child in the way he should go, and when he is old, he will not depart from it. We strongly believe in training and teaching and nurturing our kids so that when they grow old, they will always remember our love and all our inputs to them. So, without further ado, okay, we have first pala, we have this sharing question. Okay. What sensory issues are you seeing from your child? If you're a mom or a parent, a dad, and you're the one taking care of your son or your child or your daughter, what sensory issues are you seeing from your child? Is it sensitivity to lights? Is it uh, sensory issues in her mouth or taste buds? Is she picky eater? Is your child sensitive to smell? Is it in hearing? He always covers his ears. Is your child sensitive to touch? Or other sensitivity? You can share it with us. Okay, share your uh, and if you also have some questions to Dr. Kinnard, you can also type into the comment section and we will ask him later. I know. Hi, Mami Kat. Hello, it's good to see you. Hello, Sir Cheng. Hi, good to see you too. And Mami Pinky, hello. Okay, Mami Pinky says, cutting nails, cleaning ears, mostly touch and also the sound. Okay, those are the sensitivities of her child. Okay, so autism family, welcome, welcome again. Please tune in and join us so we will learn a lot. Okay, so hi, Mami Lilia, good morning to us here from the Philippines. Okay, so right now, I would like to introduce our guest, Dr. Belisa Kinnard. She is a physical therapist, but before that, she's also an autism mom. Okay, she have a child with autism. Okay, she is a physical therapist since 2009 and has worked with all populations from early childhood to geriatrics. Her son was officially diagnosed with autism at 4. Yeah, at 4 years old. She opened her own mobile clinic in 2018 and provided telehealth services with an aim to open a sensory sensitive gym or clinic. So without further ado, let let us all welcome Dr. Belisa Kinnard. Hi, Dr. Belisa. Welcome to Autism Family Support Group.
Thank you, everyone. And thank you, Josie, for having me. I am excited to be here. And I hope that the information I share tonight will help parents better understand what's going on with their child so that they can better help them get through whatever the situation is that they have. So,
wow. May I just ask, how old is your child right now?
He's 7 now. And he has his sensory issues as well. That picture of the child, that's my son at 3 when he was in preschool.
Yeah.
So back then we didn't know what to do for him. And so on picture day, he covered his ears because it was too much stimulation for him. And so that's the picture we got for picture day.
Yeah, it's good to really know that a co-mom, I mean, a mom like us can really share about sensory issues. So I'll just give you now the floor. So the floor is yours.
Okay, great. Thank you. All right, so guys, like Josie said, my name is Dr. Belisa Kinnard, and tonight we will be talking about sensory processing disorder. So I'm going to share my screen so you guys can see the presentation I have put together, and then that way, there we go. All right, and I hope you guys can see it. So we will see if it pops up here. Okay, great, it did. All right, so tonight we're going to address who has sensory processing disorder, what sensory processing disorder is, why children get it, how we can treat it or help our child that has it, and then what we can do next after we figure out that they have sensory processing disorder. So let's see if I can. There we go. Okay, so sensory processing disorder, who gets it? So tonight, like I said, we're going to talk about who gets it, and then I'm not sure if this is going to pop up the rest of my slide here, and I don't see it. So I will just go ahead and talk about it because I do have it here in front of me. So, so one of the misconceptions out there is that sensory processing, that every child with sensory processing disorder has autism. However, that's not always true. There are some kids that have sensory processing disorder but do not have autism. Now, the majority of kids with autism will have some sort of sensory processing disorder. So that's the main difference there, is that you can have sensory processing disorder. I'm going to shorten it to SPD because it's a lot to say. So SPD, a lot of kids can have it, but they may not necessarily have autism. So, but with children with autism, a lot of times you will see this comorbidity, as we call it. So there are other things that children with autism can have as well. In conjunction with autism, sometimes you'll see ADHD, OCD, and some other things that can come up because of that. So this is, tonight we're focusing on the sensory processing disorder. Oh, there it is. Okay. And then, so if you guys have heard of this term, go ahead and mention it in the comments if you've heard of it. And then we can, that way we have a little bit of an idea of what people have. So I'm just kind of reading the comments here. So thunder, heavy rain. So that's more noise. Again, they're probably sensitive to the noise. So there's different things that kids can be sensitive to. So we'll go over all of that too. Okay, so there's the difference between, just because you have SPD does not mean you have autism. But if you do have autism, SPD is usually a comorbidity. Okay, so what is sensory processing disorder? It's basically, think of your five senses. So basically the child's brain or the person's brain is not able to process what it's getting in from the outside. So normally you and I, a good example would be, normally you and I, if we're, let's say, in a construction zone and we're hearing the loud noises from the construction, we can filter that out. And so that noise becomes background noise and it doesn't bother us as much. With children with SPD, that noise is just extreme and it's more enhanced and it's very, very uncomfortable and it's very strong for them. So it makes it harder for them to be able to process that. So their brain just isn't able to process it. So think of all our senses that we have. We have touch, we have movement, smell, taste, vision, and hearing. Those are all sensory senses that can be affected by SPD. So so you'll find different things that our children will be affected by. So I'm going to just switch over here. So for example, my son has sensory processing for noise. Now, all children will have some sort of sensory processing difficulties when they're babies. But like I said, when your brain is developing, by the time your brain is developed into a mature age, around 2 years old, then your brain is able to process that and say, okay, this noise isn't so bad, it's going to be in the background, or this noise we need to hear and put it in the foreground. So our brain is able to sort all those noises out. Because of autism, my son had difficulty with that. And so everything was just super loud. And so it was difficult with crowded spaces, being around a lot of people, just a lot of noise in there. And so so we eventually realize that, okay, we need to do something for him. My older son was very sensitive to noise as well, a fire truck and things like that. Now, you've probably seen all children, react to a fire truck. So as we get older, a fire truck, oh, it's a fire truck, okay. But with children with SPD, a fire truck is still that frightening sound that we hear when we were babies. The brain isn't able to process it as something that's safe, that isn't, going to hurt us. And so when they hear it, it's like the brain's processing it as it's an unsafe noise and we need to react to it. And so we either react with fear, fight or flight. They'll either react with fear or hitting or some sort of meltdown because they just don't know how to process that. So that's one example of of how sensory processing works. There's also touch, for example. A lot of kids with ASD do not like having tags on their clothes because that rubbing on their back is very irritating for them. So for my son, he doesn't like that either. And so we were always cutting tags off. And so now they make tagless shirts, which I was like, yay! So now, I don't have to worry about that because now there's not anything there to irritate his skin. Again, it's his body, his brain isn't able to process that. If we touch and rub our skin long enough, our nerves in our skin send a message to our brain and tell the brain, this is normal, this is okay. So if you ever bump yourself, what's the first thing you do? You rub the area, right? Because we're trying to send a message to the brain that says, this isn't pain, it's something else. It's just rubbing, and so that our brain says, okay, it's not pain, and then our pain subsides. With a child with autism, those nerves aren't getting that message to the brain because the brain isn't wired the way it should be. And so those wires are getting crossed and the brain's saying, either pain, irritating, or something's hurting me. And so that's why the child is very sensitive to tags and certain clothes if they're rough. So like my son's uniform is polyester, I think it is. So it's a little bit rougher than cotton. So he wears a pair of cotton pants underneath his uniform pants because then it's not rubbing against his legs all day. And so it helps him to be more comfortable throughout the day when he has to wear his uniform all day. So, all right, let's go back to the slides and we'll continue. So, so again, because of SPD, some of the behaviors and problems like low weight, for example, I know a lot of children have trouble with eating certain textures. So again, that's another thing my son has. A lot of kids with ASD, they prefer carbs. And so, or they don't like things that have certain textures. And so they won't eat as much as a child who's neurotypical. And so a lot of times you'll see that they're either low birth weight or low weight, or sometimes it's the opposite because they're eating a lot of carbs and they're not exercising or moving, then they end up gaining too much weight. And so it's a very either one end or the other when it comes to eating. And again, like I mentioned, you'll see meltdowns, and again, poor social skills can also affect it. So. Okay, so unfortunately, as far as why this happens, they don't know. Some scientists believe, again, it's somewhere in the brain that it's just not wired correctly. The amygdala, the corpus callosum have been two of the things that scientists are looking at, but nothing has really been determined for sure. And then some studies are suggesting it might be inherited, So it's still up in the air as to what causes it, and that's okay, because once we know that our child has it, we can do things to help them work through these things. Okay. So how do you know if your child has them? Again, so to know some of the symptoms or behaviors that you'll see when a child has SPD, excuse me, You can see it by the way they react to certain things. If they're constantly moving, if they don't like to be touched. It's not because they don't want you to touch them. It's just because touching is just being processed differently in their brain. And so it might be a little bit harder. In therapy, what we do is what we call, it's called desensitization. And so with that, what we'll do is gently introduce different textures to a patient. So especially patients with RSD, the nerves have been injured, and so they don't know what to do with it. And the nerves are receiving the information, but the brain is processing it differently. And so same concept here. What we'll do is we'll gently rub the skin or the area with, something soft as a cotton, and then gently increase it to something rough like a sponge. And so that kind of helps to get the client desensitized, as we call it. So again, that's something else that you may try, but with kids with ASD, it's a little more difficult. So it's something that you want to try to accommodate versus trying to make them get used to it, because again, it's the way their brain is wired, and we can't unwire it. We can try to retrain the brain just by consistent introduction of what it is that we're trying to show them. So again, some of the other things that you'll see is they'll refuse to eat certain foods. Again, it's not because they don't like mom's cooking. It's just that they may not like the texture of certain foods. So, it's good to always just try to introduce it, try to have them taste it, maybe for a week. And then if they don't like it, then you know that that's something that maybe try something different with them. And then, and the other one is the smells. So our other sense is smell. So a lot of times kids with ASD might have sensitivity to certain smells. And so they might even throw up because of it. So you want to be very careful with, strong odors and strong perfumes and things like that. That can really affect their senses in that aspect. One, we talked about the fabrics, and then the other one is the vestibular system, which is in our inner ears. It's deep in our ears, and it's what tells our brain where we are in space. A lot of children you'll see with ASD, maybe they may look clumsy, they'll fall a lot, and it's a lot of times it's because the vestibular system isn't getting the message to the brain, and so the brain kind of doesn't know where they are. The brain can't tell, are they lying down? Are they sitting up? Are they walking, running? And so it makes it harder for the brain to develop those. So, okay, now let's keep moving along here. Excuse my son, if you hear him in the background, he's all the way downstairs, but you can still hear. Okay, so again, like the movements, like I was saying, with swinging and sliding, going down ramps, moving too fast, any sudden changes, kids with ASD just don't like. So again, because the brain just doesn't have time to process those things quickly, so it scares them versus, them saying, oh, it's okay, and you might have someone with a meltdown or they'll avoid it altogether. So again, they'll have trouble calming themselves down, and that's when we introduce co-regulating, and then have them to try to do it on their own later on. Okay. Sometimes you'll see kids spinning, jumping, and swinging because they like that sensation. And so SPD can go the other way, where they are seeking it. They want more of it. And so you'll see like repetitive behaviors or actions because they want that feeling. So some kids are sensory seeking, and some are sensory avoiding. So that's another thing that you need to pay close attention with your children. Okay, next up, having odd posture. Again, that has to do with where they are where the brain thinks their body is in space. And they might have trouble with fine motor skills, just grabbing little things, again, because of the touch they're not able to touch and feel what they are able to touch and feel, but they can't process it right. So they don't know that, oh, for this, I'm supposed to pinch hard, or for that, I'm supposed to touch gentle. So it's hard for them to process that. Sensitive to sound is a big one. A lot of kids have that issue, and the vacuum cleaners, lawn mowers, anything that's loud is going to upset them in that aspect. And then and the last one that I think I have is where they, it says lack creativity, but I think a lot of times it's that when they find something they like, they're going to repeat it over and over and over. And again, that's just a little hint of the OCD that they might develop because of their autism. So, all right. So some of the things that people that we try to use is, we try to use equipment to help the kiddos learn to accommodate, or, we don't want our children, we don't want them to be suffering through these things. And so a lot of times we come up with ways to help accommodate them so that they can still enjoy the things that, every child should enjoy. So for example, for the noise, we weren't able to go to the museums or the zoo and things like that. So what we did, we accommodated by having headphones, and the headphones do not block out all the noise, but they muffle it enough so that he could still hear me when I called him, but the noise around him wasn't so loud. And so the brain had time to process what's going on, and it wasn't so overwhelming for him. So that's one of the ways that you can help your child that way. Swinging is a great one for vestibular core strengthening. We use that because a lot of times, when my son was young, he was afraid of swinging. And so we got him we made him a sensory swing in the house. And so little by little, his brain was able to learn how to process, okay, my body's here, my body's there, swinging. And so now he's always been able to, he's never really had trouble with his physical limitations, because, as a physical therapist, I always made sure he was on point with his physical gross motor skills. But again, those are things that you can also incorporate to help your child to increase their core strength, increase their vestibular system, improve and strengthen their vestibular system. Swinging is always a great way to help them with that. The other thing that they do too is a sensory diet. So basically what a sensory diet is, where you give your child sensory breaks. So, like, for example, a lot of kids are doing homeschooling now. And so what you do is you have your child, you want them to focus on something. So you give them a sensory break. And for example, it could be running around, jumping on a trampoline, swinging on the swing, anything that's going to activate their sensory system, and it's going to help them. Like, for example, we like to recommend heavy lifting or heavy pulling or pushing, because that heavy work releases endorphins. It releases things that are going to help your child calm down. And then when you go to sit them down to do their work, they can focus better, and then they could get their work done. So, doing jumping jacks, running around for 5 minutes, things like that can really help your child to sit and focus then later. And it's a great way because it helps to expand that length of time that you need them to focus. And so that really helps a child to just stay on task on something that you want them to do. So, all right, next up. All right, so some environmental modification. So again, you can try to decrease like sensory, anything that's going to affect your child's sensory system. So the main one is noise. A lot of times kids have trouble with noise. And so you try to decrease that scary noise by increasing a noise that's calming to them, maybe music, white noise. A lot of times we use fans to help produce that white noise, and that helps them to calm down and kind of blocks out the louder noises. So, fireworks, I don't know if you guys ever had your kids around fireworks. That's like the worst. And, it's not just kids with autism, but like even dogs and animals, they're very sensitive to noise, and that is so frightening for them. And so, I can imagine what they go through too. So, when we have 4th of July around here, again, the headphones come out. We try to go somewhere inside the house. It's very hard because people do their fireworks close by, but things like that. You try to do things that are going to help them kind of put their mind on something else, so that the noise that is affecting them isn't as distracting as it can be. And then education. So again, you want to always educate your family, your caregivers, whoever's watching your child, always educate them. And if something ever happens in public, I let people know, he has sensory processing disorder, and noises are very hard for him. Just a couple weeks ago, we were at a women's expo, and it was full of people, and he didn't want to wear his headphones because sometimes my son likes to be brave. And he says, Mommy, I don't want my headphones. So I said, okay, we'll try it. But then there was somebody there with a microphone. And with the microphone, it was like, wow. So he went up to the gentleman and said, please don't use your microphone. And the gentleman actually said his daughter has his granddaughter has sensory processing disorder. So he understood, and he told him, okay, I won't use it again. So that was a great way to help, like, educate the public too, that, hey, let's consider those that may have issues with noise. And, and again, he should have worn his headphones, but, he wanted to be brave that day. So, but he learned his lesson. And again, being prepared and having things ready for your child will help decrease those meltdowns. And so it was difficult because the rest of the time he was like this, and Mommy, I want to go home. Mommy, I want to go home. It was very overwhelming for him. So we just kind of ran through everything. And, so again, being prepared is always important because you never know when you'll run into somebody with a microphone. All right. And so here's my little guy. This was this summer. He was helping me paint outside. This is when he was 6. He just turned 7 in September. So like Josie said, he was diagnosed at 4 years old, because before that we just had him in early intervention, and he was had the diagnosis of developmental delay. And so with developmental delay, he was still able to get services that he needed to help him progress through, the things he had difficulty with. So for those parents who aren't sure, I always say, go for the developmental delay under 3. And once they hit school age, then that's when we decided that we would go with the autism diagnosis, because then that would protect him at school for when he had meltdowns or he needed extra support. Those were things that would help him get the diagnosis. So, okay. So then the next thing we have here. Oh, here's this next slide. Oh, that's him calling me now. Okay. So here's an example of how, when we go out, when he was smaller, I think this was probably, this is the one on the right, is probably in May when we went for his brother's birthday. He wanted to go out to this place called Sky Zone. Is a trampoline park. Kids love trampolines. ASD kids love trampolines, but there's always loud music. It was, and a lot of these places, they have a lot of loud noises, music, overhead speakers. So we always go with our headphones. So as you can see, the one on the left was when he was smaller, and then we just progressed to regular. These are regular music headphones. So, and then here's another example of, like, he wanted to brave another thing that we went to. It was called Chocolate World, and he went without his headphones. And so he is learning to self-regulate. And so he's able to identify when he can tolerate noises. And so again, just by being around it enough and being able to experiment, you know, going different places. The first time we went there, he covered his ears the whole time. And then when we got off the ride, he said, "Mommy, I want to do it again." And he went the next time and he did not cover his ears. So he tested himself and he knew his limits. So, but he was, okay. I'm still frustrated. Excuse me 1 second. This is, here, you want to say hi? This is my son. This is my son, Micah. Say hi to our friends.
Hi.
Mommy's doing an important meeting.
I'm still frustrated.
Okay, I'll be done in a few minutes.
Please give a quick look.
Yes.
Yeah, Michael forgot.
I'm in a meeting, guys. Go. Get your,
Can I give you a hug?
okay, this is my other son. All right, say hi quickly.
Hi.
Okay, thank you. Goodbye. Go, close the door. Thank you. Sorry about that, guys. So as you can see, so that was Micah. Micah is my youngest, and he's the one who has autism. So he's come a long way because he started out with speech delay. He wasn't talking enough. So now I can't get him to stop talking. So I guess it's a good thing. So all right. So yeah. So now that we've discussed sensory processing disorder a little bit, I want to leave a little bit of time for any questions that anyone might have. And again, sensory processing can be addressed with occupational therapy. We worked together with his occupational therapist, and we brainstormed and said, okay, what does Micah need? How can we help him? And so, and again, you know, educating ourselves as parents, I did a lot of reading on it too, and made sure that I wanted to see what I could do for Micah to help him with all his issues. You know, they taught us in OT for eating different things to introduce by saying, okay, smell it first, then touch it, then taste it with your tongue, and then take a little bite. And that has helped him to be able to try new foods. Not always, but it does help when I want him to try something new at least. So he'll at least try it that way. And if he likes it, we eat it. And if not, then that's okay. We'll try again another time. But those are different ways that occupational therapy can help you figure out how to help your child get through the sensory processing disorder and help them to regulate themselves. And self-regulation, that's a whole nother lecture there. But again, it's important because once they are overstimulated because of the senses, then you want to know how to help them bring themselves back and into the calm state, because otherwise a lot of kids can either be 10 to 2 hours in a meltdown, and that can be really tough for everybody. So again, OT has helped us learn strategies for that as well. So physical therapists can help in that they can help you with exercises that you can do to help your child really activate those senses and learn to, you know, use them and help the brain to get accustomed to them. So a trampoline, we ourselves have a trampoline, we have swings, we have the headphones, and what else? And like I said, we accommodate with the clothing so that when he goes to school, I make sure he has clothes that he likes. And, you know, it depends. We did try a compression vest, not a vest. It was like a compression, what do you call them? Tank top. It was like a tank top. And it just offered that compression for the sensory, because when he was smaller, the deep pressure helped him to relax. So that's why people use weighted blankets. That helps give kids that pressure. And there's also weighted vests that people can use. But again, you know, and sometimes, you know, Josie, you mentioned there's lots of dogs. Dogs actually are very comforting to kids with autism sometimes, especially the big ones, because their weight and the heat they provide. When the dog sits on the child, that really helps to calm them down. So anyone who has dogs, if you ever notice that, that's probably why, because that weight of your pet is helping your child to calm down. So I would love a dog, but nobody wants to pick up poop. So we're not getting a dog. So, okay. So if anyone has any questions, I'd be happy to answer them.
So, I have a question when it comes to the white noise. So it's my first time to really hear the white noise concept.
Mhm.
So ca- so those things are really helping them to be able to cope up with the other noises, like the sound of the fan you mentioned.
Yes, white noise is more to help them calm down. So like at nighttime, or like if it's raining outside or something like that, the white noise will help them calm down because it's a soft noise and it's constant. It's not sudden. Like my son's still scared of thunderstorms, and so like anytime the thunder comes out, so for that I just hug him tightly, give him that deep pressure to help him calm down. So you kind of have to find out what helps your child, like what do they prefer? Do they prefer um another noise like white noise, or do they prefer some deep pressure, or finding those things out to help them self-regulate. But the white noise is more just to help calm them down. But again, exposing them to different noises at different times is always good, but again, it's the unexpected noises that puts them into a meltdown. So, letting your child know, hey, look, here's a fire truck, and then you push the fire truck button, and they know, oh, okay, that's the fire truck sound. And the more you do it, the more they get desensitized to it. So next time they hear a fire truck, then it won't be as bad as if, they never hear it, and then it's like, oh no, and then they have a meltdown.
Okay. How about those who those kids who always climb up to higher places? Is that also a sensory issue?
Yes, because they're seeking sensory input. So what they're seeking is that like a deep pressure. So and when they jump, they're getting it because they're jumping onto something hard, and so they are seeking that pressure. So another thing is to that they may not notice where their body is in space. So even though they're high, their brain isn't telling them, "Hey, you're high, be careful," and that fear doesn't set in. And so and that's where like the swing would help, because that helps to activate the vestibular system. And so that tells the brain that, hey, this is where we are in space. And then the brain can give the right signal of like, okay, we need to be careful. A lot of kids, like my son used to like climbing too. So I would just put down a bunch of pillows and say, okay, then you need to jump on there. There's these things called crash pads that people get. They're a little bit more expensive, but those are nice foam, soft foam pads that kids tend to jump into, and you'll see them at like at trampoline parks. They'll have crash pads where kids can jump into and things like that. So that's another option too.
Basically, with if your child has autism, I mean the three most important tool or things that you can use are trampoline,
Mhm,
swing,
mhm.
and what's the other ones? The
Trampoline,
noise cancellation gadget.
yes. Hmm.
Those three basic things.
Those are, yeah. And again, the swings, the sensory swings are expensive, to be honest. And so what I did was, those pull-up bars that people buy to hang on their doors. I got one of those, and then I bought what is that? A hammock that was on sale for like $12. And I hooked it up to that, and the hammock served like a nice little swing in the doorway. And and he's enjoyed it since, until he fell, and then he didn't like it anymore. So
Yes, as parents, we can really be resourceful and do improvise things, but
mhm.
we can really do some swings. Actually, we can have our yeah, pillows and put some rope on it and everything.
Yes, yes.
So
Even like a tire, you can tie a
yeah,
tire to a tree. That's another way to do it. So yeah. Mhm.
because it used to be that my son keeps on bumping to to edges, to things, to people. So I think that is also one of his problems, right? So he needs more of that swing
Mm,
and the trampoline.
mhm.
But he
Yeah, and
keeps
again,
on
it could be. I'm
but
sorry,
it
go
keeps
ahead.
on jumping up and down every now and then.
Mhm. Yeah, he's
Um,
sensory seeking, so he's seeking that sensory input of the up and down, and so yeah, and again, him bumping into people, it could just be his brain doesn't know where he is in space, and so it could be vision. It's always good to have your kids' vision checked. That's usually the first thing the doctor says. Check their vision, because they just might not have good peripheral vision, or there might be something going on there. So it's always good to rule out the other things first, and then make sure that's not what is affecting them.
okay, so can you also say that desensitization or exposing to the sensory issues will really, really help them if you expose them more?
Yes, but being careful, because I know I don't want people to say, oh, I need to expose them, so I'm going to just let's put them in a loud space and hope they need small increments at a time and over a long period of time. It's not something that their brain is not going to is not going to be able to adjust quickly. So it's going to take time and doing little bits. Like for my son, we started at 3 with him with early intervention, and he's 7 now. And only at maybe around 6 years old, he started saying, I don't want to wear my headphones anymore. I'm gonna try without my headphones. And so, he was self-regulating himself. But he knows when there's something too loud, he'll tell me, Mommy, I want my headphones. And, we'll try to have them there for him. But again, it's not, something that's going to change overnight, but it's taken him 3 years to get to that point. But being consistent and not being afraid to take him out, but using his headphones has really helped him to see that, hey, I could still enjoy that with my headphones and I don't need to be scared of it. And so, we're able to do different things every year. This past summer, we went to a lot of places, and sometimes we used our headphones and sometimes we didn't. So he really has come a long way when it comes to the noise sensitivity.
Wow. So, Dr. Kinnard, if you would allow me, I will just show some of the announcement. I'll just give some announcement before I ask for your
Sure, I'll stop
your
sharing. Let me
final,
stop.
final words. But I
Okay,
just have to share my screen too.
okay, there you go.
I have, yeah, I have to share my screen. So please, I'm just going to do some announcement, very important announcement. So parents, please bear with me. I just have to, yes. Okay, let's have some announcement because we're going, before I read some of the questions here also. So, okay, for our announcement, okay, this coming Friday, we're not going to have a Facebook Live prayer that we usually do on Friday, but we're going to have it in Zoom meeting. So please use our usual Zoom codes, and I will also post that in our group. It's going to be called Tagpuan or Our Secret Place. It's going to be for us parents, just a time of relaxation, time of just enjoying the presence of God, joy, being filled, having peace of God and rest of our soul. So it's an hour of just expressing our love and just receiving love from God. And then next week, okay, we're going to have another guest from the US, and this is um, Teacher Liz Estefani. She's an not occupational therapist. She is a speech pathologist, speech therapist pathologist. Okay, so our topic next week will be communication and helping children to go from nonverbal to verbal. And this is going to be the same day, Thursday at 8 p.m. US Eastern time also, because she is also from US. So, and also we have a wisdom quote of the week. Our wisdom quote is, unless the Lord builds the house, the work of the builders wasted. Unless the Lord protects a city, guarding it with sentries will do no good. The horse is prepared for the day of battle, but victory belongs to the Lord. That's in Proverbs 21:31. And then commit your actions to the Lord, and your plans will succeed. That is Proverbs 16, verse 3. And last but not the least, but seek first the kingdom of God and his righteousness, and all these things will be added to you. That is in Matthew 6:33. So as I'm always saying, we can only do so much. We can give them input, lots of input, our kids. But of course, a touch from God, there is no impossible with God. When God touches them, it's worth a lot and hundreds of times of therapies, because with God, we will receive a miracle. God can really do and turn the situations around. So can we just have a short prayer? Okay, let's pray this. Heavenly Father, thank you so much for caring for me. Lord Jesus, I recognize that I cannot do things just by myself. I need you. I believe you are my Savior who loves me, who loves to help me. Forgive me for not depending on you most of the time. I surrender all my worries and my child's autism journey to you, knowing that in you, nothing is impossible. Please guide me every day to know you and bless my family. Amen. Okay. So thank you so much uh for bearing with me with that, parents. So I would like to ask for a final word from Dr. Belisa for all of us parents, especially nowadays that we're just staying at home, and most of us, we cannot also go out. We're just doing this by ourselves. We're even, all the classes are online. So we parents are the one who's really taking care of our kids. Okay. For Miss Mami Kudera Crisel, I think there's a question here. How can I help my child improve his speech? He's 7, nonverbal. Can you also address that very quickly, Dr. Kinnard?
Okay. So first off, amen to the prayer. So yes, I do want to mention that in our journey, I always pray over my sons, both of them, because I do believe that, God gave me Micah for a reason. And, I think his reason was that he needed me to help spread education and also, help people understand what autism is, that it's not, it's nothing that's bad, but that it's different, and that, we just need to learn to accept these kids and help them, because they can be very, very productive to society. They can be, very loving and gentle. And yet, on the other hand, yes, they can be very intense. I think with them, they just feel everything intensely. And so, we just have to help them learn to control that. And as we raise our children, whether they have autism or not, we teach them things that society expects them to have. But I think it's time now that we teach society to be more tolerant of people who are different. And I think that's why God gave Micah to me in that aspect. As far as improving the question about improving speech, again, I think next week's
Yes.
live is going to be very helpful for that, because unfortunately I'm not a speech therapist, and Micah did receive a lot of speech therapy. And it was funny because he went on a winter break, and then he came back talking, and they were like, what happened? I'm like, he decided to talk. I don't know. And so, it was his time. He decided, I think I'm going to talk now. But
Yeah.
again, it's very important for all parents to know that when your child receives speech therapy, occupational or physical therapy, to follow through with what they're doing. ask questions, find out, show me, tell them to show you how to do it. Because for me, the key has been to follow through with what they were doing at school and making sure that I was reinforcing it at home. And so that, and I think that really, really has helped him come a long way, because if I just rely on them to do therapy 30 minutes a week, that's not going to help. I mean, seriously, it's not. It's up to us parents to
True.
really get in there, learn what they're doing, and consistently provide the same reinforcement. And a lot of times I'm guilty of it. I'd rather not deal with the issue and just, give into what he wants. But you do have to be stern. Like, I don't treat Micah any different than what I treat his brother. And, I don't want him to feel like he's different, but he does know that he has to follow the same rules as his brother. And sometimes we butt heads. Sometimes, sometimes we cry together. Sometimes we laugh together. But, he knows, and again, consistently, that, this is how it is. And this is how he needs to, help control himself. So, and sometimes he'll turn it around on me. They taught him to take deep breaths when he gets angry. And so when he sees me get angry, he said, "Mommy, you should take some deep breaths." I said, "Really now?" Now, it's funny because he'll turn it around on me. He knows what he's being taught, and it's just a matter of whether he will or not. So consistency is the main word there that I want people to know, is to be consistent and continue to reinforce what you learn in their therapy sessions so that they can continue to practice it with you.
Yes. Follow up is really very important at home, and also from your word, we really need to believe in them, believe that they understand us, because sometimes, although they don't look like it, but they do. They understand us. And then there's one here. Okay, Mommy Jen says, agree on this, doctor. We used to put our radio on while there is thunder. And then Mommy Mitch also says, how to approach love who constantly laugh on her own. Is that also a sensory processing?
I don't know if that is sensory processing, but honestly, if they're laughing on their own, I think the best thing to do, and this is what we learn a lot with early education or early intervention, is to get down to their level. So if your child is sitting on the floor, get down on the floor, and if they'll let you, remember, they like their space sometimes. If they'll let you, you say, what's so funny? Tell me, show me. And, whether they're pointing at something or they're looking at something, say, what's over there? What's so funny? And engage with them and see, let them bring you into their world, and let them show you, what it is they're laughing at. It could be something funny they saw on TV that they are remembering. A lot of times kids with autism script, and that's basically when they're repeating over and over. My son could literally repeat a whole video word for word because he scripts, but he does that mostly when he's nervous or when he's upset. He'll start to script, but any other time he's fine. And so when he does that, I know that something's wrong, and I'll say, "What's wrong, baby? Are you upset? What's going on? Did something happen?" Or if I talk too loud, and I was like, "I'm sorry for yelling. What happened?" And things like that. So it's just a matter of, but again, consistently, if they do it a lot, just, every time ask them, what are we laughing about now? And, and then one day they'll let you know, and, when they're ready. And but you just have to keep asking and keep asking, what's going on? Let me in your world. And they will when they feel comfortable.
Wow. Thank you, Dr. Belisa. You make everything sound so easy. Yeah. And we really want to thank you in behalf of all the autism parents, families. Thank you so much for sharing your expertise to us. And hopefully this can have a repeat soon in the future. And we
Yes.
really thank you. Yeah, because you have talked a while ago about whole session of another topic about something that you have said. Also,
Mhm.
we will be looking forward to that. But we just want to thank you again. Parents, thank you for joining us. This video is going to be available in our YouTube channel, Autism Family Support YouTube channel. So you can go back to it and learn from it again. So we will be ending the Facebook Live. So thank you very much, everyone, for joining.
Thank
God
you for
bless.
having me.
Yeah. God bless.
God bless you.